A public health approach is taking a whole systems approach, so it's taking all of the agencies together to look at this. It takes a strategic and long-term approach to it. It brings agencies together, not just to look at individual incidents, but to look at long-term prevention and the causes of violence against women. So it's a way to really reduce the level of violence against women and to address it in the future. So you're in for the long play in terms of a public health approach, but it is one that really brings all the resources to focus on this extremely important issue.
So gender inequality and violence against women affects everybody in Scotland in lots of different ways, regardless of where you live. And I think that developing a public health response to that is fundamental, because we need to be thinking about the whole picture of gender inequality and how we live our lives and how we support other people. And so putting it all together makes perfect sense, because it's everybody's business and we need to be thinking about that on a day-to-day, strategically, long-term and together.
So one of the benefits of taking this approach to tackle violence against women and girls is not only that we'll potentially make lives better for women and children in their communities, but we'll also save the public about £2.3 billion, and that's the rough estimate of how much we're spending and how much damage domestic violence can do in Scotland.
I think we can make huge inroads into preventing violence against women. I think we will create safer communities, we will create more inclusive communities. We will, hopefully, people will recognise that they've all got a role to play in preventing all forms of violence against women, and that we live in thriving, healthy, safe, vibrant communities that everybody enjoys accessing and living in and working in.
The advantage of adopting a public health approach when we're looking at violence against women and girls would be the overall advantage that public health reform has in all aspects. So it would be around the fact that we're looking more at prevention rather than tackling and dealing with the problems. So looking at those kind of long-term interventions that we could be making in order that in many ways those that are here today and whose careers are based around dealing with violence against women could find that they've actually solved the issue, and there isn't the systemic issue that we have in Scotland at the moment that's been identified this morning.